The mannitol excreted in urine, if given in large doses and serum osmolarity greater than 320 millismol per milliliter, there is a risk of renal failure. Should be monitored the patient closely so that the serum osmolarity should be measured every 6 to 8 hours to target أقل من إنه 320 ملي اسمول per milliliter. Force catheter should be inserted to monitor the urine output and to facilitate renal excretion of mannitol to prevent renal failure. Another than mannitol, hypertonic solution, hypertonic saline, is a mainstay for the treatment of patients with intracranial edema, inducing hypernatremia or providing a solution with hypertonic or increasing level of sodium has been demonstrated to both increase cerebral perfusion and decreasing intracerebral pressure in the setting of multiple pathologies like patient with a stroke, subarachnoid hemorrhage, and mass lesion. Induced hypernatremia can be achieved within a solution ranging from 2 to 23.4%. يعني نسبة الهايبرتونيك solution أو sodium inside this solution is ranging from 2% up to 23%. Could be given bolus or continuous infusion, but in ICU. Peripheral intravenous access can be used if administering 2% hypertonic solution. لكن 3% and above, we need a central venous access to avoid phlebitis and regional necrosis. Regional necrosis يعني damage of body tissues at the site of infusion لأنه في عندنا hypertonic solution. The second point, in addition to the mannitol and hypertonic solution, is providing respiratory support. We have to achieve the normocapnia, which is normal PaCO2. As we said previously, the elevated level of PaCO2 as in respiratory acidosis, making the PaCO2 or the CO2 is patent vasodilator, increasing blood volume and increasing ICP. In addition, decreasing level of PaCO2 as in respiratory alkalosis, this may make arterial vasoconstriction, decreasing blood supply to the brain and making ischemia. In addition, making a vasoconstriction in the venous blood, so that decreasing outflow and increasing ICP. So that we need to maintain a normal capnia. Hyperventilation strategy is used to decrease the PaCO2. As we said, in order to decrease the respiratory acidosis, the PaCO2 less than 25 mm mercury. To decrease ICP, but severe prolonged hyperventilation could lead to ischemia لأنه الرespiratory alkalosis بيعمل arterial vasoconstriction, so that decreasing perfusion and ischemia to the brain. Hyperventilation should be avoided in the first 5 days after traumatic brain injury because of the effect of hypoperfusion and decreasing blood supply to the brain. The suction should be limited to no more than 5 to 10 seconds. Passage the catheter 1 to 2 times to avoid overstimulation and to avoid cuff reflex that may increase intrathoracic pressure and increase ICP. Third point, as we said, there is hypertonic mannitol. Second point, respiratory support. The third point is the analgesic, sedation, and anesthesia, and all of these 3 points using in the first line therapy to treat increasing ICP. This analgesic, sedation, and anesthesia used for pain, agitation, anxiety, and confusion. Analgesic, narcotics use fentanyl, anticonvulsant, morphine could be used. However, respiratory monitoring should be, because this drug may lead to respiratory depression and death. Intubation equipment should be available. Narcotic antidote يعني morphine. شو الانتيدوت للمورفين. Please search about the antidote of morphine. شو هو الانتيدوت للمورفين. The naloxone should be ready. طبعا الجواب معروف اللي هو naloxone. The vital sign monitoring for pulse oximetry to monitor the auto saturation. Start with the lowest dose, then increase, then titration should be made. Sedation by using benzodiazepines, midazolam, diazepam, lorazepam used for sedation before ICU procedure. Administer at the lowest dose to produce effective sedation and vital signs monitoring لأن هاي الأشياء ممكن تعمل respiratory depression وhypotension. For patient who is unable to communicate, physiologic parameters are used to determine the effectiveness of pain management. The nurse assesses the heart rate, respiratory rate, using of accessory muscle for breathing and the blood pressure. If the patient has stable vital signs, good blood pressure, decreasing heart rate indicate that the pain is low. But if the patient has a tachycardia, this may increase that the patient is still in pain. Anesthesia like using propofol, a continuous infusion to decrease agitation in a critically ill patient. A common side effect, hypotension, so that frequent monitoring is needed. The patient should be intubated while he or she on propofol, because leading to respiratory depression, and the patient should be on in ICU. Propofol lines should be changed every 12 hours because it's made from fat emulsion مواد دهنية, and it's a good media for bacterial growth, and the patient cholesterol level should be monitored daily and should be calculated for that within the total or the daily requirement. يعني لازم نحسبها هاي الفات كالوريز من الديلي requirement.